do you offer liposuction to the stomach area instead of a tummy tuck? No, I don't. Now, you can do it. Just because I don't offer it doesn't mean it's not an okay thing to do, because I know some people do it. And a lot of plastic surgery is kind of like people's experience. And this is one of those ones where it's people's experiences and own personal kind of views on things. Because in my experience, I have struggled with doing liposuction to the tummy area, to the central abdomen. It works well to the hips and flanks, to the sides, but to the central abdomen, it doesn't work well. And so my best way of contouring the central abdomen is a tummy tuck. Now, the problem is there are people out there who are not candidates for a tummy tuck. They haven't got enough spare skin. You need to have a certain amount of spare skin to be able to do a tummy tuck. Now, you could do a mini tummy tuck if you haven't got that much spare skin, but a mini tummy doesn't do anything to the bit above the belly button. And so there are people out there who would like to have liposuction to their stomach, to their abdomen, but I have had kind of mid results. Mid being I'm not sure if it's in common parlance, is a term my children use, mid. So if something's not very good, they say it's mid, which kind of makes sense really. So yeah, the results have been mid in my I'm going to pin my goal, in my experience, because liposuction doesn't remove skin, and often the problem is skin, and you can get wrinkly skin, you can get dents, you can get contour irregularities when you do liposuction to the central abdomen. So therefore, I never say never, but I don't really do it. And if you're a candidate for a tummy tuck, then a liposuction is really not going to be the trick, because liposuction will not remove skin. So if you're a proper candidate for a tummy tuck, then I think you really do need a tuck. Don't have just liposuction. But I understand there are people out there who aren't really good candidates for tummy tucks, who might be good for who just want some liposuction. If that is you, if you do feel that you do have excess fullness a little bit of excess fullness in your tummy area, it might be that an assisted form of liposuction like VASA or some kind of assisted form of liposuction would be a good thing. These do report to cause some degree of skin retraction. So they deliver energy to the fat before you remove it. And so something like VASA might be an option for areas where the classic types of liposuction that I perform are not so good. And those are areas like the tummy, the arms, another one, arm and thigh, the arm, the thigh. These are all areas that I struggle a bit with doing kind of normal liposuction where the skin doesn't retract. And so that might be an option to look at VASA. I don't do VASA, so I can't, say too much in terms of what the results are like. You need to speak to someone who does it to see what the results are like, to see whether that be a goer for your abdomen. So yeah, liposuction to the central abdomen is not something that is big on my list